So for all of my clinicals that I just finished, I would have to say that they all were pretty eventful and they went good for me. So my first clinical, I had a transport, and I'm not gonna lie, the transport was probably the most boring out of all of my clinicals, although I did have to drive a patient all the way to Bloomington from Portage. So it was a very far drive. It took up most of my shift, but it really did teach me, and I did get to experience how it really is being with the patient for so long, having to talk to them when they're bored or talk to them when they get scared. In my case, I did have a child, so it was more of having to keep them entertained when they got scared and wanted their parents, and their parents weren't there. I did have, like I said, that call took most of my shifts, so I did not have many other patients after him. My second clinical was a 911. That one, for me, I think was a lot more interesting. I was in and out of the ambulance a lot more than my first one. My 911, I think my last call was actually the most adventurous, crazy call. That one I just learned that you never know who you're gonna come across. Every patient is different. You have some patients who you have to communicate with on a whole different note. And that's something that's sometimes challenging because you can get done with one patient and they come to the next call and it's a whole different situation. You have to approach it completely different. You have to approach the patient differently. Some patients aren't as cooperative, which is what I learned, than others before or after. Now, when I did my hospital clinicals, I would say I enjoyed the ambulance more, but the hospitals, I feel like I learned more. So with my first clinical in the hospital, it was actually on Christmas Eve. I was expecting that to be busy, and it actually was extremely dead. I think I had barely any patients that day. I know I did. There was some walk-ins. There was nothing traumatic. There was walk-ins of someone who got positive with COVID, flus, nothing special. My other ER clinical, I put a external catheter in, the Pierwicks, and that was my first time doing that. I did a glucose sugar on people. I did so many EKGs. I feel like that clinical in the ER, I was never sitting down. That clinical in the ER was very busy that day. I had to go into a room, patient after patient after patient after patient. The waiting room was booked. I had someone cut their finger. I had a dog bite. I had a lot of cool stuff. But yeah, I feel like I learned the most in the hospital setting than what I did in the ER. I think it's because in the hospital settings, the nurses can always show you something, or else when you're in the ambulance, it's not like they have a patient in another room they can pull you into and show you stuff. So, but I did enjoy the ambulance more because my 911 ambulance, I think, was my funnest clinical out of them all. So that is how my clinicals went.